as adults, I think the most visit, which is dreaded by all of us, is to a dentist. So imagine when you are so scared of the dentist, what your child, a 2-year-old or a 3-year-old, would be going through. So today we have a guest who caters only to these children. The guest name is Dr. Umangi. Welcome, Dr. Umangi.
Hi.
She is a pediatric dentist.
you.
If you can tell us a little bit about what you do, which is different from other dentists.
Okay, so I have a clinic in the name of Kids Dental Studio, which is an exclusive pediatric dental clinic. My USP is that because kids are quite scared of going to any adult clinic, or maybe if you speak about even a hospital, they are quite scared of entering a pediatrician's clinic or a physician's clinic. So I have tried to make my waiting area very attractive, very colorful, because the more colors you put into any space, it brings more happiness to a child. We have a lot of toys which is age specific. I also have wall mounted board games that keeps the child busy and very happy when the child is into any particular hospital. So this is how, as soon as the child enters my clinic, a lot of anxiety goes down. From I would say from 90 to 80 anxiety, it almost goes down to 30 or 40.
So what I would like to say first of all is that it is like going to a kindergarten.
Yes, more or less, yes, because we have meds on the floor, and then we have toys put on a single
So child
side.
feels that he is going to play rather than he is going for a visit to the doctor.
Yes.
But sometimes I've noticed children, especially there's something known as nursing bottle caries, where almost all the front teeth are destroyed.
Yes.
So in this case, it's not 1 or 2 teeth, but quite a number of teeth which need to be treated.
Yes.
So I think that would take a little longer time.
Yes.
So do you get cooperation with just a play area, or do you need to do something else?
No, say for example, a 2-year-old child or a 3-year-old child is having nursing bottle caries. When there is a lot of amount of cavities inside the mouth, I would say out of 20 teeth, almost 10 to 12 are involved in that case. So when there are more number of visits for that particular child, it becomes very difficult for them to cooperate in the later stages. So for that purpose, we do have an in-house general anesthesia machines. Along with that, we have an anesthesiologist who is always present with us while doing such cases. And the machine which we have in our clinic is almost of the same category onto which heart surgeries and liver surgeries are performed. So we have a very high-end anesthesia machines, which becomes very easy for the child, for the parents, and for us to operate
and safe.
upon. And
basically
safe,
most parents are worried
about
that general anesthesia itne chote bachon ko denge.
Yes.
So that fear you can put at rest at your clinic. And I've had the occasion to visit your clinic, and I've seen your chair. Even that is mint size. It is the size of a child. So he's not like engulfed in an adult dental chair.
Yes.
So the child feels more comfortable.
Yes. So basically the chair, the instruments which we use are all meant to be used only for a kid. To give you an example, I think almost 90% of us would have got a dental filling done, which is a very simple procedure. And you would have seen that usually when a dental filling is done, the cements which we use are manually mixed. Now the manual mixing takes a quite longer time. It's sometimes even messy if your assistant is not trained enough. So to elevate all this part, we have a special machine for it which mixes the cement in 4 seconds. It takes next 4 seconds to load into my instrument and another 10 seconds to put that filling inside a child's oral cavity. So the entire dental filling procedure, which takes around 25 to 30 minutes in an adult, is usually completed in around 10 to 12 minutes in a child. So this is how a pediatric dental clinic is meant to be. Faster process.
And catering to children only, basically. Everything which is small, so that they don't tend to get scared. What about laughing gas? I have heard that laughing gas is a kind of anesthesia which was used a lot for children. So do you use it?
Yes, of course. So laughing gas is basically used for elder kids like around 7 to 8 years who are quite anxious in spite of all our efforts after behavior management and after talking to them a lot about the procedure, so in spite of all this process, if the child is quite scared or anxious, we put on laughing gas that reduces the anxiety of a child, and then we can perform a simple procedure of
Which
giving a
does
local.
not warrant a general
Yes,
anesthesia,
no,
basically.
yes,
Okay.
which does not warrant a general anesthesia case. A
So
borderline anxious
that's amazing
child.
listening
Yeah.
from you. And do you cater to adults at all, or?
No, I don't cater to a single adult. I think after 2012, I have not seen a single adult.
You only cater to children. And the
Yes.
maximum age is?
So the maximum age is 15 to 16 years.
And the youngest?
Youngest is just born.
Oh,
Yeah.
wow.
Yeah.
Oh, yeah, I do remember some newborns are born with natal
Natal
teeth.
teeth,
So in those
yes.
cases, you're required to do an extraction immediately
Yes,
so that they
yes.
can feed, I think.
Exactly.
So you also cater to that.
Yes,
Oh,
I do.
wonderful, Umangi.
Yeah.
That I think is a sure blessing to many of my clients who are listening to this
Yes.
podcast, because not many are aware that such a
Aware.
dentist is even available and who can make their child really, really comfortable in a dental
Yes,
environment.
yes.
That is wonderful. Now, what I would like to know is, we already heard about which college you passed out, your passion for this. Did you directly start your pediatric clinic for children, or did you do something else before that?
No, so I passed my master's in 2015. From 2015 till 2017, I was working as a freelancing consultant.
Okay.
So basically, it's like visiting different dental clinics wherein the doctors give an appointment on my behalf. I do the treatment for the kids, and then it's usually done.
Obviously, the chair is not your pin size, and that is why your clinic was born, I
Yes.
think. Okay.
So in 2017, basically I conceived in February 2017, and it was getting quite difficult for me to visit the dental clinics, different dental clinics, because I was also going to the peripheral areas like Kadi, Kalol. So it was getting quite difficult for me to visit those places. Plus, the second thing which I realized was that the environment which actually the kids need was not available for me. So behavior management, explaining the kids, elevating their fear was quite a lot difficult. But only thing which was bothering me on opening up a clinic was that being a female, it was quite burdensome for me to balance my work life and balance my social life. So meanwhile, my co-PG, Dr. Kisha Mehta, she was practicing in Bombay, and she planned to shift here in Ahmedabad. I was handing over all my consultations to her, and she proposed to me of opening up a clinic, which was an exclusive pediatric
Where is
one.
this located for our clients?
Yeah,
who are
so it
listening
is
to the podcast?
located near Navrang Circle. So
Okay.
if you have, I would give a broader area, is the Vijay Crossroads.
Now, the very fact, like when I started the podcast, most people who are actually listening to us are listening because I said that the number of children having dental caries or decay in their mouth has increased in the last few years.
Yes.
So, do you think there is a reason for this?
Major reason behind increasing of such a huge amount of decay is accessibility to junk food.
Oh,
Accessibility to sweets. Like if you compare kids in the olden times, I remember that me getting a cake was like only on my birthdays.
okay.
Whereas a child nowadays is getting accessibility to sweet foods, I think almost every day. Plus the amount of snacking in between meals is quite more. Usually when a child is having 2 or 3 meals like lunch, dinner and an in between one meal, it is very rare to find a decay or a cavity in such a child. But because of more accessibility to say chips, the sweet foods in the market, chocolates and everything, their in between snacking time has increased.
Okay.
So usually when the saliva needs at least 3 to 4 hours to return back to its normal condition, but when there is so much of in between snacks, the
So
saliva
do
is
you
almost
advise
acidic.
your patients, child patients, on not to eat? And if you tell them, does it work? Or do you have to counsel the parents as well? And how do you go
So
about doing it?
yes, I do counsel my patients as well as the parents for the kids who are having more amount of cavities. Why? Because another reason which I skipped to tell you is that nowadays kids, most of the kids, I would say 90% of them have food while watching screens.
Yes, it's true.
Yes.
I know my daughter does it.
Yes.
So
So now what happens is whenever a child is watching a screen, you are more concentrated on that part rather than the food. So there is a lot of pouching of food that is happening inside your oral cavity. And the meal time, which is supposed to be somewhere between 15-20 minutes or say max 25 minutes, lengthens, extends up to
I
almost
have
1
also
hour.
seen children with their mouth stuffed, children are force
Yes.
feeding them. So they've got one pouch of food here, one pouch, and still the mother is stuffing more
stuffing the
inside.
food,
So that is
yes.
bad actually.
Yes.
Let the child eat on his own and the amount he wants to eat.
Yes.
I think another is the nursing bottle caries that I referred to.
Yeah.
Not many people realize that they are responsible for what the children have. So if you
Yes.
could throw some light on that, how to prevent nursing bottle caries to
Yes.
parents who have just had children
Yeah.
and the ones who are doing something wrong. What is it they are doing wrong?
Yeah. So starting from when a child is born, it is very important that you start cleaning the gum pads. Even if you are feeding, it is very important. If the child is not having any teeth, it is very important that you clean the gum pads.
How do you clean them?
So then you can use a damped cloth, a mull cloth or a cotton cloth. You can wrap around your finger and then you can just clean the gum pads. It is very effective way.
This is when there are no teeth also.
When there are no teeth also.
Okay.
Yes.
And once the child starts getting teeth?
Once the child starts getting teeth, you have a series of things to be followed. The first one to be followed is that when a child is having around 4 or 6 teeth, you can use a finger brush. A finger brush is very effective. It just goes into your finger. You can wipe it, clean it, and that's done. That's all. Then
This is especially if they are still breastfeeding.
breastfeeding. Yes,
Okay.
yes, especially
And
when
that
they are
generally in
breastfeeding.
India, I think they breastfeed till almost 1.5 years.
Yes,
So by that time, at least 8 to 10 teeth are already there in the
yes,
mouth.
yes.
Okay. And these 8 to 10 teeth are the first to be damaged when you have.
Yes,
Okay.
yes.
So that damage is prevented by the finger brush, or do you need something else as well?
No. So the other thing which is required is that in particular the night feeding. The night feeding is the major cause of this nursing bottle caries, because whenever a child is night fed, there is a lot of sugar particle from natural sugars from the milk that tends to stick onto the teeth. That creates a film. And there are certain bacteria which are already present inside each one of us oral cavity.
Okay.
So that bacteria start utilizing that sugar. It breaks it down into smaller particles, and the byproduct which is formed is acidic.
That's what causes the decay.
Yes, so
So when
that
you see
causes
those
the
really
decay.
cute children, when they smile and you see those
Yes.
brown teeth in their mouth, it is
Yes.
not the child's fault, but more the parents'
Yes.
fault who has been exposing them to night feeds.
Yes, and one misconception is that those stains are because of iron.
Okay.
That is one major misconception with which the parents come to us. They tell that these are the iron stains because we have been giving iron syrup
supplements.
to the
Okay.
to the kids. So whenever you see the smallest of a smallest spot, it is very much important
to get
that
them to you.
Yes, to get them to us. At least you come to know that how to take care, because there is a lot of lack of awareness regarding the oral hygiene.
So is there any message that you would like to give to our audience?
So one message I want to pass on to the parents is that as soon as your child is born, the way you take your child to a pediatrician, the way you take your child to a neonatologist, it is as important and as crucial to take your child to a pediatric dentist, because we are the ones who would help you to learn more about the oral hygiene of how to take care of your kids, right from the child is having no teeth to your child is having permanent teeth.
So basically, I think what we have understood from this entire conversation is that prevention is better than cure. So rather than taking your child and putting the fear of dentists into him, it is always better that you start maintaining it and teach them to continue maintaining their oral hygiene so they do not get decay to begin with. And I think that was a very valuable piece of information that you've shared with us today, Dr. Umangi.
Thank you so
Thank you
much.
for being with us today.
Thank you.
And
It was my pleasure.
we are hoping that a lot of people give you a lot of questions on your Instagram.
Yes.
And thank you very much again, Dr. Umangi. Thank you for a patient hearing.